My name is Akil Merchant, and I'm a physician at the Cedars-Sinai Medical Center in Los Angeles. And my lab studies lymphoma as well as other cancers in the tumor microenvironment. The Lunaphore COMET platform is an automated staining platform. For us, the automation, we believe, leads to better reliability. What our lab is interested is in developing biomarkers that can help us predict how patients with cancer are going to fare with a certain treatment. If we want to deploy those clinically, reliability, reproducibility are cardinal features of any kind of test. One of the things we're very excited about is a hyperplex immuno-metabolic panel, where we're able to look not only at the different immune cells and their states within the tumor microenvironment, but also at their metabolic state. And there's a lot of data from many investigators suggesting that the metabolic state of immune cells is going to tell you a lot of information about how active they are and whether they're going to be effective in responding to different treatments that stimulate the immune system. We have developed a panel of about 82 markers. It's a combination of markers against different immune cell types. There are different states, activation, exhaustion, as well as their metabolic state. We've pushed up to 80 markers and have plans to go beyond 100. So it's really a great discovery platform for us. And on the other side, because of its automation and reproducibility, we're really excited to develop potentially clinically deployable tests, perhaps at a lower plexing for using that in clinical use. So we really cover sort of both aspects of what our lab's interested in.